Hej. Jeg har glæden af for 3. år i træk at være moderator på Frank Spears kursus, når han kommer til København. Det første år, der var emnet, at vi skulle have demystifying occlusion, og andet år, der var det så treatment of worn dentition. I år, der hedder kurset The Art of Treatment Planning. Og umiddelbart, når man hører titlen, så kan det jo godt lyde som om noget med at få solgt mange kroner og store behandlinger til patienter og så videre. Men det er bestemt ikke det, der er hovedemnet for kurset. Emnet for kurset, det går på at vælge den rigtige terapi, og det kan være i forhold til, hvor lang tid tanden skal holde, hvor lang tid den kan holde, og hvor mange penge patienten har til at få lavet behandlingen for. Så jeg vil meget kraftigt opfordre jer, som ikke har været på Frank Spears kursus før, men også dem, der har været på Frank Spears kursus før, til lige at lytte til den teaser, som Frank har sendt til Danmark, så I kan få et indblik i, hvad det er, han kommer til at snakke om på det her kursus. Og kurset er helt klart også et kursus, som er standalone, så det fungerer også rigtig, rigtig godt, selvom man ikke har været på de 2 første kurser.
Hi, I'm Frank Spear. I'm looking forward to being back in Copenhagen. This will be my 3rd year in a row, and I've always had a great time. 2 years ago, we spent 2 days talking about occlusion. Last year, we spent 2 days talking about managing the worn dentition, so diagnosing, treatment planning, and treating patients with significant tooth wear. This year, we're still going to be focusing on treatment planning, but we're taking it to a different level. It's actually a topic that I've never presented in Denmark before in all the years I've been coming there. And we're going to talk about the integration of minimally invasive concepts into patients who have more complex problems. Now, typically when a dentist hears minimally invasive, you think about very, very tiny burrs and minimal tooth preparation, and I'll spend a small amount of time on that. But the reality is what I'm going to focus the most on is the kinds of patients that you're not sure what to do with the teeth. Is it a tooth that should be retained? Is it a tooth that should be removed? How do you make those decisions? And what we're going to be talking about is a fundamental concept that I like to call management versus cure. A lot of times, at least in the US, there's a tendency right now for particularly younger clinicians to think that if you see a tooth that has questionable prognosis, you just take it out, put an implant in, and that cures the problem. Well, we know today, as we get more and more history on implants, that there are a lot of maintenance issues down the road for implants. Even though they have a very high survival rate, they still have a lot of maintenance issues. And just taking a tooth out and placing an implant doesn't assure you that you've cured the problem. So the concept of management versus cure is to think of it as, how do I manage a patient who has complex problems? It might be just one tooth or it might be a whole mouth. We're going to focus on both. But how do I manage that patient so that if I can get 10 or 20 or 25 years out of a tooth before it has to be removed, that's a very valid treatment plan. So we're going to be talking about teeth that have things like ankylosis, internal and external resorption, apical root resorption, horizontal root fractures, advanced bone loss. And I'm going to be walking you through this decision process, this decision tree algorithm of the questions that I would ask about any tooth before I would ever think about removing it. And I'll be able to show you some very long-term follow-up, some well over 30 years, on teeth that were, quote, deemed hopeless. And so that's going to be sort of the theme for this year's 2 days. As part of that, we're going to talk about things such as what orthodontic extrusion can do to help you save teeth, when it works and when it doesn't. We're going to be looking also at the challenge of anesthetic implants. If somebody did take the tooth out or you took the tooth out and over time the result hasn't been pleasing aesthetically, what are your treatment options for managing anesthetic implants? And so it's really going to be 2 days about treatment planning, whether to retain teeth or remove teeth, with the focus on trying to retain teeth and restore them whenever possible, even if it means they're not going to be there for the long term. So that's where we're headed this year. I'm excited about it. As I said, it's not a topic I've ever done in Denmark before, but it's one of my favorite topics to present here in the US. So I hope I get to see you. I'm looking forward to it.